Hi, my name is Caitlin. One safety measure I take every day in my environment is making sure that the lint is cleaned out of my dryer. If it is full, it can be a fire hazard. What is one safety measure that I would add into my environment is making sure that I'm not overloading my outlets with cords. Because we're working from home, I tend to have a lot of things plugged in, so making sure that when I'm done using the cords, I unplug them. What's two potential hospital room hazards a nurse should be aware of is making sure that the bed is lowered and not raised, as well as locked, and then making sure the side rails are up to prevent the patient from falling out of bed. What is one intervention to prevent falls in a hospitalized patient is making sure that when they are up and moving around, they have those non-slip socks on to make sure that they have a grip for whenever they are walking around the hospital floors. It can be pretty slick. The biggest takeaway from the case study video would be communication. When you notice something that may be wrong, it's best to have a second opinion or maybe multiple opinions, especially with the PPE, making sure the visitors of the patients are aware of how to use the gloves properly and hand washing skills to make sure that they are also not spreading infection. One pro and one con from the safety with keeping in fusion pumps outside of the COVID-19 patient rooms. One pro would probably be conserving the PPE. The staff aren't being exposed to the patient as often, and we aren't using that PPE as often either. A con would be taking fewer trips into the patient room in order to conserve the PPE, and that can be an issue because there's low opportunities to actually interact with the patient and check on them and making sure that nothing else is wrong, because you're not always checking into the patient's room, so you may not know if they need anything. And yeah, thanks.